Hi, from the World Bank IMF Spring Meetings in Washington, D.C. I'm Priya Basu, Executive Head of the Pandemic Fund, and I'm joined here by Dr. Uma, the Acting Director of the Africa Centers for Disease Control. Welcome, Dr. Uma.
Thank you for having me.
So let me start by asking you, what lessons did the African continent learn from earlier pandemics like Ebola? And how did you apply those lessons in the context of COVID-19?
When we saw large outbreaks like Ebola, cholera, measles on the continent, we were picking lessons. And some of the key lessons that we learned, which we put into use during the COVID-19 pandemic, I'll share three. The first was the need to act with speed. During the previous times, particularly Ebola in West Africa, it took time before actual action happened at community level. And we learned that lesson. With COVID, we started from the word go. The lockdowns came when the numbers were still very small, and that helped to keep the numbers low. The second lesson we learned is this is not a health response only. It is a response across many sectors, finance, agriculture, education, transport, and we needed to bring all of them on board early so that everyone knows what their role in managing the outbreak and managing the pandemic is. This worked well. The third was resources. Many times before, a lot of the resources that were being used in response were resources that were coming from outside of the continent. We learned the lesson that if you have local resources being made available, it's made available faster and it's made available at the local level where it is required. So we mobilize resources from our governments, from our private sector, from non-state actors, and those resources were very key in the early success of our COVID-19 response.
Great. So what are some of the new lessons that you've learned from COVID-19 in terms of preventing and managing future health outbreaks? And how do these lessons translate into 2 or 3 key priorities for the Africa CDC and key priorities for the continent?
I'll share 2 that we've learned during the COVID pandemic that we are very keen to ensure that we are implementing and quite rapidly. The first was a painful lesson, and that is when you don't have manufacturing capacity for health products that you need in emergency response, then your whole response is dependent on the domestic policies of another country. So we took the decision and made it a priority for Africa to manufacture its own health products, from simple things like masks to complicated and complex things like vaccines and therapeutics. So it has become right now a priority for the continent for local manufacturing, and we are expanding what exists and putting in place new manufacturing facilities. The second lesson we've learned during the pandemic that we are turning into a priority is the need for a standby force of experts. You don't want to mobilize experts only when you have an emergency. You want the experts to be there doing their work throughout the year. In this way, one, you get to know early when you have a problem, and second, and very importantly, is that when the problem has been identified, then you respond fast. That is why we have made a priority to invest in public health emergency operation centers, which are manned throughout the year. And second, we have also made it a point to have the Africa Volunteer Health Corps. These are experts that are in place and they are working within the health sector. When they are needed in a place where there is an outbreak, then we deploy them to those areas. So these 2 lessons we have learned for manufacturing and for having experts on standby throughout the year.
Excellent. So manufacturing of vaccines, experts, ready for the next pandemic.
Exactly.
Hopefully that won't be in the near future.
We want to delay it by further action.
So just shifting gear a bit, can you tell us about your partnership with the World Bank?
So the World Bank, we've had a partnership for quite a while. In fact, The World Bank was one of the first partners that supported Africa CDC when it was inaugurated in January of 2017. The first investment that the bank made in Africa CDC was around strengthening regional public health assets. And we call it the Regional Laboratory and Surveillance Networks, RISLNet, where the bank was supporting some of our countries to build their capacity to be the regional powerhouses, if you want, to be able to support other countries around these two countries. And the two countries we picked on were Ethiopia and Zambia, where we are building that capacity at a local level to support the countries around them. Now, when the pandemic came, it was clear that that first investment was touching a very small part of the need. And the bank came in, and right now the bank is supporting institutional capacity building of the Africa CDC. And by extension, it is also supporting institutional capacity building of the member states on the continent. It's a $100 million grant over 5 years, which the way we have designed it is going to leave capacity at country level. Although we call it institutional capacity building for Africa CDC, the vast majority of the funds are actually going to build the capacity of country level institutions, whether they are for public health institutes, whether they are national CDCs, or whether they are research institutions that are actually contributing to the work of Africa CDC.
Great. We look forward to partnering with you even more in the future. So, Dr. Duma, last year the international community came together to set up a new multilateral financing mechanism called the Pandemic Fund. As you know, you are part of the board of the Pandemic Fund. And what makes it different is that it is the first multilateral mechanism that's dedicated to strengthening pandemic prevention, preparedness, and response in low and middle income countries. How do you think the Pandemic Fund can best help you and the continent?
So, one is we like the idea of a pandemics fund because it is dedicated to an area that Africa as a continent needs support, and that is health security. And we also like the pandemics fund because it is designed to prevent. It is not designed to just respond. And so building that capacity on the continent will mean that we are better at picking up outbreaks early, and we are better at institutions that can be able to respond quickly. The way we see the Pandemics Fund supporting the continent is in addressing priorities that we have identified. There are cross-cutting priorities like the one I described of workforce development, very important on the continent, building a network of laboratories that can be used for diagnosis of any new pathogen that comes into place, and also strengthening early warning systems. So the Pandemics Fund can also do this across board. More importantly is the Pandemics Fund we expect is going to build the capacity of countries themselves, so that when there is an outbreak, it is locals who are responding fast before even Africa CDC comes into the picture. When there is a disease threat, it is the local capacity that is identifying it, that is characterizing it and containing it even before help comes from outside. When the Pandemic Fund does this, it means that we'll be avoiding large outbreaks because we'll be arresting the outbreaks when they're still small. It means we'll be delaying or completely avoiding a pandemic. So we see the Pandemics Fund as filling a very important void that is there in the global health architecture, and we are going to work together with the fund to make sure that Africa can be able to fully benefit from this multilateral instrument for financing and health security.
Great, thank you so much, and really looking forward to our continued cooperation. Thank you for your time.
My pleasure.